Hello and welcome. You're about to watch the video or presentation called Accessing Local Support as part of the Wellbeing Education Resilience Programme. We'd like to highlight the Face COVID video by Russ Harris. If you haven't already seen it, please do take 5 minutes to watch. It gives a great overview of how to support wellbeing in response to the COVID-19 pandemic. You can click directly on the link from the PowerPoint presentation when it's in slideshow mode.
This is the 9th video in the Watch element of the WER programme. It focuses on accessing local support. There may be key concepts that are touched upon very briefly in this video that are explained in more detail in the concept index. These are marked with the blue star with CI in the middle. Should you want any further information or have any questions on anything covered in this webinar, you can book onto one of our Q&A conferences. This webinar will cover the following: person-centred approach, the structure of the Thrive model, the Thurrock Thrive model, writing referrals, and how to support while you wait for responses. When looking for the most appropriate support for somebody seeking help, it's really important to make sure that they're at the heart of the decision-making process. This is called a person-centred approach. Everyone seeking support has the right to respect. That means that they are able to review, have effective help, select, progress, expression, clarity, and transition support. Review means that they are able to know what options are available to them and the pros and cons of each of those options. Effective help means they know the evidence for the help and support being suggested. Is it evidence-based? What is that evidence? They need to know if there are different types of help that may be more effective or just as effective. And they need to know what is expected from themselves or others within the treatment process. Select means that they have the option to make their own choices about what help they get with different evidence-based approaches exist. Progress means that they are able to be involved in the decision-making process, in the goal-setting process and reviewing of the goals. It means that they have the right to know how long it will take for any improvements to happen, and they have the right to agree what will happen if things don't get better. Expression means that they'll be listened to and their views will be taken into account. Clarity means that they have the right to know how those supporting them understand their difficulties, and they have the right to know what is happening with the information about them. Transition support means that they have the right to some sort of support in the transition between either accessing the support or if there's further support that's needed following a form of intervention. The Thrive framework is an integrated, person-centred and needs-led approach to delivering mental health services for children, young people and their families. It was developed by a collaboration of authors from the Anna Freud National Centre for Children and Families and the Tavistock and Portman NHS Foundation Trust. It conceptualises need in 5 categories: thriving, getting advice and signposting, getting help, getting more help, and getting risk support. Emphasis is placed on prevention and the promotion of mental health and well-being across the whole population. The framework empowers children, young people and their families by encouraging them to actively take part in the decision-making about their care, which is fundamental to the approach. The 2 images on the screen show the 5 categories of the Thrive model. The image on the right screen, thriving, getting advice, etc., is an image of the Thrive model that you have seen before, whereas the image on the left describes the input that is offered within each segment. This image was created using the language obtained through consultation with children, young people and parents. Each of the 5 segment groups is distinct in terms of the needs and/or choices of the individuals within each group, the skill mix required to meet these needs, dominant metaphor used to describe the needs, for example, well-being, ill health or support, and the resources required to meet the needs and/or choices of the people in that group. So first of all, we'll be looking at the middle section of your Thrive model, and this is thriving. So in this section, you're looking at all those children, young people and families who do not currently need individualised mental health advice or any other sort of help. This doesn't mean that they will not benefit from general interventions to support mental health, such as community initiative to promote mental wellness, emotional well-being and resilience of the whole population, or whole school approaches to promote well-being. These groups that we're targeting are sort of our more preventative groups and measures. So it's important to remember that some students and families that have experienced hardship may still fall into this category. It may just be that actually they're quite resilient and they are doing quite well and they're able to manage what's going on for them. So working with targeted groups who may be more at risk of falling away from this group based on environmental, economic or family factors is another way to support these students. So these might be students that you know are going through a lot at home and are coping really well, but they are more at risk of falling out of this section. So you may wish to do more targeted approaches with them. So this section of the Thrive model, you're looking at prevention work, you're looking at promotion of wellness and well-being and good mental health. You're looking at more whole school approaches and looking at everybody looking after themselves. And it's likely to happen more so in the community. So community promotion of good mental health, you might have things like youth clubs, for example. So in this section, we don't just want children, young people and families and adults as well. We don't just want them to be existing and coping. We want them to be thriving. We want them to be happy and well and doing the best they can. And we want them to be as resilient as possible. So these are the types of support that you will get in the Thrive model, and these are the types of people that you will be providing support for. So it's basically everyone. Next, we're going to be looking at getting advice. So this is usually sort of your one-off type of advice. It would be the people, sort of people that would be falling into this category might be people that just want, exactly as it says, advice on where they might be able to go to gain some further support. It might be people looking for self-support. It's looking at people with mild mental health difficulties or needs, or very much temporary difficulties or needs. So it could be that it might not be mild, but it could be very temporary, and in which case they won't necessarily need a long-term form of support. So these sorts of supports, as I say, will be temporary and mild. You'll probably find them more so in the community and within the education sector. It might be signposting. It could be also, so as I've said, it's usually people with mild temporary, but as I did start to touch on, it could be people that have recovered from episodes of more severe poor mental health, shall we say, and they're having a little bit of a relapse, or they may be fluctuating between poor mental health and their good mental health, and they just need that one-off piece of support to get them back on track again. It could be self-support, so lots of websites, apps and things like that. Or it could just be a one-off contact, so for example, a support line or an advice line. If we move on to getting help, this is sort of the next stage in the Thrive model. It looks at targeted intervention support that would usually last over a number of weeks. You'd have a number of sessions. It might be people who are struggling with their mental health, or maybe they're having lots going on at home. There might be conflict in the home or something like that. And they just need maybe a targeted evidence-based program that they're going on, for example. These are usually run by trained professionals or specialists in a certain area, or maybe clinicians. So they're usually in the health sector or the public sector. This, as I explained, the interventions will usually be focused and evidence-based, so you might have things like target setting and aims led. It will be specialised technicians, so they'll be trained in offering that particular support. It'll be a form of treatment. As I said, it could use professionals. Now we're looking at getting more help. Getting more help is a section where it may be an intervention that needs to be a bit longer lasting, so there might be something going on for them mentally or emotionally that is slightly more of a form of support that needs specialised training, or that would need to be more than just several weeks. So, for example, things like eating disorders, it could mean that they have to visit the hospital for etc. For example, sorry. So, as I said, it's more long-term treatment. It may include inpatient care or outpatient provision. It's more complex mental health needs and conditions. And it would be health professionals or more specialised technicians. So this last segment of the Thrive model is getting risk support. So as it says, this is your young people, families, or adults who may be at risk in some way. So you'll be looking at more sort of multi-agency collaborative support for them. It could be those who have had lots of support in the past and it hasn't necessarily worked. So it's looking at what else can we get going for those. It could be those who are putting themselves at risk by themselves, or it could be those who are at risk by others. So it's looking at what kind of support can we put in place for those. As I said before, it could be those who have had support previously and it has been unsuccessful and therefore currently don't have any support, but they are at risk. It could be those who have not been able to access support prior to them coming to you. It could be those who are routinely in crisis, or those who may be self-harm, for example. So one of the aims of getting risk support is to get them to really engage with support. So for example, if you've got someone who is at risk and they haven't previously wanted to engage, this is at a point where you really want to aim to get them to engage. It could be possible hospital admission. And as I said before, there will be a lot more interagency collaboration. So it will be a lot more time and effort going into the sorts of people seeking this kind of support. This is the Thurrock Thrive model. So it is specific to Thurrock. It lists all the different services and agencies that are available to you in Thurrock. So we've separated it into children and adults so that you've got the option available for staff and your children, young people and colleagues that you might be working with. Also for maybe the parents in families of children that you might be working with. It's updated every half term, so it's really important to keep up to date with your knowledge around your services in the Thrive model. These will be allocated to every school, so if you want to find out more about it, you can speak to your mental health lead. Another really good way of keeping up to date with services could be attending our mental health network meetings run by the School Wellbeing Service. This is because lots of professionals from different agencies and services will attend. It is also really good for being aware of their referral processes and what they've got on offer to support our local people in Thurrock. So like I say, it's really, really important to keep those relationships and to build relationships with services so that you really have a really good, robust idea of what is on offer for you. If you look at the Getting Advice section, you can see that there's a lot from the School Wellbeing Service in there. There is a lot from local services such as NELFT, and a lot of it is covered in the school. So you're looking at your pastoral support, your PSHE lessons, etc. There are a few online charities, foundations and resources that you can use there too. If you're going to the Getting Help section, you've got a lot more of the sort of community-based support services that might be run by Thurrock Council, etc. We also have in Getting More Help, you've got your more clinical support, so your NELFT, UMES, Mind, Open Door, Little Havens, etc. It's really important to be mindful as well. I'm thinking if you're working with colleagues or families where there's domestic abuse, this is generally the section where you're looking for a lot of your support in here. On the bottom, we've got your different types of interventions for thriving. So this is where we're looking at our promotion. Again, you'll see a lot of it is in the school. When you're looking at your school's Thrive model, this will have what specific interventions you have run by your school. They'll be in there as well. So again, in your Getting Risk support, more clinical, and you're looking at your collaborative working kind of support, so MASH, social services, hospital outpatients, etc. It's really worth taking time to look through this, so you can pause the video here. If you have any questions on any of the services or agencies or websites or options available to you on the Thurrock Thrive model, you can contact your mental health lead, or you could always contact our school wellbeing service support line for a bit more information.
In this section of the presentation, we want to help you think about what to write when you're making referrals to other services. I think it is about what you want the service that you're sending this referral to, what you want them to know, and what it is that you're asking for. What is most important to you, and what are your concerns, and what is your worries, and what is the service that you're inquiring after. Does the referral information read as you're experiencing the student's behaviours? So trying to capture a sense of what this looks like in reality, the kinds of difficulties. I know you're describing them using words, but try and be descriptive about what you're seeing and how people are saying about what they're feeling. You can think about different people's perspectives, so gathering information from the child or young person themselves, about how they see the situation that they're in currently, from the family, and from staff's point of view, so that you're gathering information about concerns from different angles. It can be really helpful to, once you've gathered some information, to let somebody read over it who is familiar with the child or young person, but who hasn't been so close to it in terms of writing and reading all this information and collating it as you have. And sometimes it's helpful for them to spot whether something makes sense or whether or not there's any gaps in the information that you've recorded. If you're making referrals to places like Early Help or Thurrock MASH, then it's really helpful to use the Common Assessment Framework form. And in the notes below on the presentation, you'll be able to see some more prompts and details about what's helpful to how to fill that form out. We'd like to take some time now to think about the kinds of information that's really helpful for you to include when you're making a referral. And as you can see, we've got a really basic referral request here. And please can you see this 15-year-old girl who's been really teary and upset. If a service receives a referral with just this basic information, they're going to need to find out a lot more information as to whether they can make a judgment about whether this is something that their service can provide some support with. So we're going to suggest some things for you to think about. So the first thing to think about is actually what is it that this young girl is asking for? What is it that she's saying? What does she want? What does she feel that she needs? And what is she willing to try or consider or find out more about? Thinking about the person-centred approach that was talked through earlier in the respect model, this is really important to make a start with planning any referral with the young girl and their family in mind. In thinking about the information that you might actually contain and include in the referral, how often are they upset? So can you collect some kind of data or sense of how often this is happening? A couple of weeks where somebody's upset once a week or once or twice a week is very different to somebody who's being distressed on a daily basis. So if you can get some kind of sense of this, it's really helpful. And what is it that the young person is upset over? Are they upset over one particular thing, or is it various reasons? Are these usual things that might worry or concern this particular age group, or is it something unexpected? And how distressed are they? What is their level of distress? And how can this be summarised and found out? Is it something that might be able to be scaled on a scale of 1 to 10? Could you ask the young person to share their measures? So in thinking about measuring how upset they're feeling. And you could ask staff to consider how upset or they think that she might be, or how concerned they are, so you can get an idea of, from different people and different perspectives, around what the level of distress is. And thinking about what the word upset might mean. So are you thinking she's upset and she's angry, upset and she's teary, upset and she's sad, upset and she's really anxious and worried about things? So what does upset actually mean? And what kind of level of this are you thinking about? What behaviours are you seeing? And have there been any changes in her behaviour? So we perceive behaviours of communication, and our distress is something that's often shown through our behaviour. And have there been anything that's been going on that's noticeable? Is this young person particularly more withdrawn or less sociable? Or have they become more needy for time and attention from people? Are they a little bit more clingy, or finding it harder to separate from their friends or from their family members? Are they seeking connection more and needing larger amounts of attention from people? How are they behaving? Are they shouting, swearing lots, getting upset, losing their temper? Are they less patient with people? What kinds of things are we seeing? And it's really helpful to describe some of these behaviours that we see. How is this young person engaging in school? Are they attending? Are they able to go to their lessons? Are they able to participate when they're in their lessons? And how are they reacting when they're faced with challenges? They're stuck on a piece of work or they need help. Can they ask for help? How do they respond when an adult or a peer tries to help them? What's their concentration levels like? Is that increased or decreased? What kinds of behaviours are you seeing in their learning environment? As well as including things that we're concerned about, it's really important that we include things that we know that this young person enjoys doing, hobbies that they participate in, the particular strengths that they have, things that are going well for them. And it's really important to portray this as well, because this can help services decide what types of support might be able to be offered that can build on their strengths, and they might be more preferable to engage with if it's something that they are happy doing and enjoy doing. It's also really good information to think about whether there's been any changes in their engagement in hobbies and activities. This is quite a good indicator of how emotional things are impacting on their life and their behaviour and day-to-day connection with other people. So, if they like to do football or play netball or go to particular clubs or sociable events, are they still doing that? Are they keeping that up? Or have they stopped doing things, and have they stopped to attend or stopped taking an interest in things that they used to be actually really like spending time doing? How is their eating and sleeping and drinking going? And actually gauging some kinds of levels of their patterns is helpful to think about the impact that the stress or distress might be having on the young person. Is there anything going on recently, any changes? How's their physical health? Is there any concerns from the young person themselves or from their family around their physical well-being? How long have they been this way for? So it's really helpful to try and engage a sense of a timeline of when the young person began feeling more upset and teary. Has this been something going on for a few days, weeks, months? Is this a longer term context? Have they been previously upset in the past and they've recovered with some support and now things have kind of gotten worse again? So it's helpful to kind of get some kind of context. Most of the time people do manage support from people around them, and they kind of manage and recover from their distress and cope with things. But actually, if this doesn't have the impact that we think it might do, and that actually there's a longer kind of time going on, then it's helpful to seek some more support. And if there is severe distress going on a daily basis, then if that's been going on for 2 weeks or more, then it's helpful to start seeking some support from other people and to start getting some kind of consultation and ideas about what might be helpful moving forward. What support have they had in the past? So is this something that has worked before for them, that they might have stopped doing or stopped accessing, that actually could be thought about again? How did they get on with previous support? Or did they find it beneficial or useful? Is it something that they would like to have again? Or maybe they might give some feedback. The young person might say, actually, I'd like to try a different type of support, or actually this might work better for me now that in the situation that they're in currently. So thinking about what they've had before is helpful. What's going on with their relationships currently? How are they relating to other people? And how is that going with people their own age? Have they got friends? This is really difficult at the moment, obviously, because of the situation with the COVID-19 pandemic and being in and out of lockdown or in and out of attending school, not attending school. So how are they keeping in contact with people, and how has this impacted on the relationships and the quality of how they're interacting with other people? And who is their support network? So who are they connected to, and who are they more likely to seek support from and talk to? At home, in school, within their friendship group, within wider community, maybe in people within sports clubs, faith groups. If they're a child or young person in care, who is their network in the team around them? Who are the people who are likely to be able to be helpful to them? And what does the young person think about who is in the network and who are they most connected to? Thinking about significant life events. So have there been any major life events, experiences that could have been traumatic, created a sense of loss, or maybe disruption to relationships in their life? It might have been a house move, a relationship breakup, bereavement, maybe a physical health issue. It's not about the amount of significant events that have been going on. It's about thinking about, considering how the young person has coped with and responded to the impact that these events have had on their life. So it's about thinking about that as well as the amount of events that have been happening for them. What helps them to feel better when they're upset? It's really important to get an idea of things that they do and how much the young person is aware of what helps them to feel better and how able they are to put those things in place for themselves, or whether they're needing adult support to help themselves to feel better. Are they aware of what helps them? Do they like to distract themselves? Do they like to take themselves off and be alone? Or do they like to connect to other people? Do they like to be active, or do they like to relax? And this information can really help to ascertain what kind of support might be helpful moving forward too, and what kinds of things we can encourage them to do more. What about risky behaviours? Is there anything that's causing harm to themselves or to other people? So this might be self-harming behaviours, risky behaviours in the community. Are you worried about them being vulnerably sociably out in the community? Do they need immediate safety plans to be put into place? If you have safety plans already, then sharing these is really helpful to see if they need to be updated or anything added to them, and linking obviously with safeguarding systems where necessary. So once you have this information, it's really, really important to then check back with the young person to say, we've gathered this information, how does this all sit with you? This is where we're going to make the referral to. How are you feeling about that? And then actually what young people are telling us is they really value it when adults who make referrals to other places to seek support, that they check back in with the young person every now and then to update them on how that referral is going. Have they had a response back from the service? What are people saying about or suggesting? Has it been taken to another group to be discussed? So they like to be kept in the loop along the way, and that's really helpful for them. And this really does embody what the respect model that was talked about earlier and being person-centred in our approaches really is all about. When you've made a referral to another service for support, here are a list of things that you can be doing while you're waiting for a response. So it's really important that you ensure the young person has got somebody that they can trust and talk to. And in particular, you can promote the idea of emotion coaching. There's more on emotion coaching in the concept index video and PowerPoint presentation. So please do have a look at that as an approach for how to respond and talk with somebody. If you need to do any risk assessments, make sure they're done. If it's around self-harming behaviours and concerns, you can use the self-harm toolkit for this, which has some suggested ideas about risk assessing in there. Regular check-ins. This is really interesting in terms of how this will be done during lockdown. So it's about being creative about how you can check in with young people when they're not actually in your school every day in physical person. So it's about other ways in which that you and the young person are happy with in terms of how you can keep in contact with them. So this could be things like text messaging or postcard posting, or it could be something around video calling or using the systems that you have, particularly ones that are safeguarded and approved within your school system, to be able to communicate with young people that might be at home. Do they need any extra provision? So obviously, while they're out of school, this is difficult to provide, but once young people are back in school, what kinds of provisions might they need to support them during the day, to help them with their wellbeing in school? And this might come under the teams of pastoral, or it might come under the special needs teams as well. So just be thinking about who needs to liaise with who and the kinds of provision plans. This might link to SEN support and having particular intervention plans in place. So it's thinking about the different things in which you're providing as a school system in order to promote their wellbeing and support their emotional wellbeing and mental health. And it's really interesting to be strengths-based. That's one of our whole school approach themes, is around looking at what's working, looking at what their strengths are, what they enjoy doing, what's working for them, and really increasing their awareness of that, and increasing and finding more opportunities for them to do things that are working well for them, going well for them, things that they like to do and spend time doing, and thinking about, are there any additional ways in which you can do that? And you might use some particular structured approaches for this. You might use the 5 ways to wellbeing, or you could use the high 5 to feel alive approach. And both 5 ways to wellbeing and the high 5 to feel alive approach are covered and talked about more in the concept index. So if you'd like to have a look at those some more, then that's where you can find out more information about that. Now we're at the end of this session, it's a good time just to check in with yourself and to see how you're feeling now. As we said in the beginning, the content of the WER programme can impact on how we're thinking or feeling and how it relates to us in our everyday lives. If you've been affected by anything you have read or heard about today, please seek support, either from your own support network, and there's some ideas listed on the slide here, or from additional support networks, whether that's local services or national sources of support. The Thurrock COVID-19 Child Wellbeing Support Line has been set up to support children, young people, their families and school staff during the coronavirus pandemic. It is for anybody to call or email if they'd like to speak to somebody about an issue or a theme to do with wellbeing. This can be staff from school, parents and family members, young people themselves. If they call the support line number or email the helpline email, leave a message with their name and contact number, and someone from the team will call them back. There are also some other contacts here for local support services. Following on from watching one or more of the videos or presentations in the WER programme, you may have questions about the content or themes from your school around wellbeing more generally. So for the Ask and Share aspect of the WER programme, we've scheduled a series of webinar conferences. These are online events, question and answer sessions that school staff or other professionals can come along to virtually and join us in a panel of people working in Thurrock. At these, questions that have been submitted can be responded to and discussed, or good practice can be shared among the schools. It may be that you want to work collaboratively as a whole staff to decide on what questions will be submitted. And more dates will be added to these conferences throughout the spring and summer term. For more information about the dates and how to book, you can check online to where the presentations are listed, or ask your school's mental health lead for more information.